Thank all of you so much for your testimony in this critically important discussion about human impact on people's public health, especially women and children, when we do nothing about climate change. Through the chair, I'm going to respectively disagree with Dr. Royster and just tell you I lived in a community, and I still am raising my 2 boys, where it is very hard to see the direct impact. However, you know, I thought that smell was normal. I thought that CO2 was normal. That it wasn't impacting people's lives the way now I see a third of the classroom when I read to them raising their hand when I say, how many of you have asthma? I do this intentionally because I want to stay grounded in understanding and believing in them, because of the trauma of not being believed when you're saying you're being poisoned by CO2 and other kinds of pollutions out there. I had the most polluted zip codes in the state of Michigan. 1 of 5 children have asthma, Dr. Royster, and I can tell you, we have the only oil refinery in the state of Michigan. We have some of the most largest polluting corporate polluters in the state, in my district, in the 13th congressional district. You know, Dr. Bernstein, you discussed in your written testimony about, I think you called it fumes across fence line, found that African-American children in southeastern Michigan suffer over 2,400 asthma attacks annually caused by oil and gas pollution in the air and miss over 1,700 days of school. This is something I talk to school administrators about, the fact that they have high rates of absences when there's high, you know, when you hear about corporate polluters getting violations passed that weekend because they outputted more than their air permit required. And it really is something that I think for those at home, for my 13 congressional district residents, I just want them to know I believe them. And there are doctors and scientists out there that believe them, that CO2 output is killing people. Asthma attacks kill people. I have 3 times higher rate among adults. In 48216, in the zip code 48216, has asthma hospitalization among adults, 3 times. These are real public health impacts. And so I'm going to, through the chair, respectively disagree with the information provided by Dr. Royster, and I don't have a question for you at all. However, Dr. Goldstein and Dr. DeSalvo and Dr. Holder and Dr. Bernstein, I want to know the direct impact on women, especially women of color, when this administration has not pulled its weight to protect kids. What can parents and communities do at the grassroots level to keep children safe?
I'll be happy to start, because I appreciate very much the verb you just used, which is do, which is something I hope the committee will look hard at and find ways that there can be bipartisan common ground for actions that we could take together that would protect people today. And so some examples would be requiring more partnership between public health and healthcare on the front lines, and using data in the way that I described in my testimony. We know a lot about communities, children, people of color, but we're not always accessing that information to be targeted and strategic in protecting people from any kind of an impact, and also supporting them after they've had some negative impact. So publicly available tools like Empower, that started in the Obama administration, continue to this day, are a way that local communities can identify people at risk, get them help they need, not during disaster, but to help build resiliency. And so I hope that we'll be able to find ways to work together in the near term to support people who really need our help.
In Florida, we've developed there's a whole list, if you go online, of all the community resources that the action groups that have come together to fight this, because we're at the front line in Florida. We're feeling the sea level rise. We're seeing our beach erode. We had Zika. We have extreme
Dr. Holder, I always say, when you say front line, I love that, because I always say, you want to see what doing nothing on climate change? You want to see what doing nothing looks like? Come to the 13th congressional district and I'll show you block by block of people with cancer and asthma, respiratory issues. Again, doing nothing does result in death. And people really hurt by the fact that government is doing nothing to protect them.
Absolutely. We also, with the Florida clinicians, that's one of the goals. But on the ground, we have local communities, poor communities, that are developing resource centers in the hearts of the poorer communities, that before a storm, the poor folks can go and get water, they can get food. Because if you've never prepared for a storm, if you don't have money, you can't get water, you can't get food, and you can't go to a shelter without your own food and water. So they're creating these sites in the community and giving mental health services at those sites. So we're mobilizing efforts to help the poor community. It's for us, by us, and we know, but we need the government to come in and support and recognize that whatever the cause, fossil fuels and everything else, the poor, the most vulnerable are suffering now. And should we sacrifice that population so everybody else can have? I don't know. To us, that's not the call. That's not the answer. For us, is how do we mobilize our forces to help the current situation now and the vulnerable now?